Hey Sam, I've been thinking a lot about first aid recently. You know, given our regular participation in these high-risk sports, I feel like we really owe it to ourselves and our friends to attend first aid training courses regularly. Have you ever taken one?
Yeah, I've taken a couple over the years. But it's been a while, and you're right, it's something we should stay on top of. First aid is crucial, especially for us. The basics are straightforward. Keep people breathing and stop them from bleeding. It's not rocket science, but it can be life-saving.
Absolutely. I recently read a chapter on first aid, and it made me realize how essential it is to have a system in place for handling emergencies. The key is to stay calm and think logically, which can be tough when adrenaline is pumping. Do you remember the mnemonic for accident procedures? It's really helpful.
I think I do. It's ABCDE, right? Assess, breathing, circulation, deformity, and emotion. This sequence really helps to make sure nothing vital is missed.
Exactly. Assessing the situation includes checking safety and the level of consciousness of the victim. Breathing involves ensuring the airway is clear and breathing is normal. For circulation, you check the pulse and look for bleeding. Deformity involves examining for fractures or internal injuries, and emotion is all about reassurance and continuing care.
That makes sense. And I guess if you get confused at any point, you should just finish what you're doing and start from the top again. The sequence really helps keep things in order and priority.
Right. When approaching an injured person, it's crucial to first survey the scene. Understand how the accident happened, check for any additional victims, and ensure your own safety first. You can't help others if you become a victim yourself.
Safety first, for sure. Also, we need to consider how to get medical assistance if necessary. If someone is seriously hurt, stabilizing them and getting them to a hospital or bringing paramedics to them should be a priority.
Yes, and knowing what to have in a first aid kit is important. Sterile dressings, band-aids, non-stick dressings, triangular bandages, and conforming bandages are essential. We should always have 2 kits in case one gets lost.
And don't forget about improvisation. Duct tape, electrical tape, foam from camping mats, and even polythene bags can be adapted for first aid purposes. Duct tape, for instance, can immobilize fractures or waterproof dressings.
Speaking of improvisation, if someone has a neck injury, we can use the foam from a PFD to create a neck brace. It's all about being resourceful with what we have. And those extra large triangular bandages you can make from polythene sheets are really useful too.
Exactly. The plan of action typically involves getting the victim safely to shore first. If they're okay, we can continue the trip. If not, we administer first aid, evacuate the injured, recover equipment, and then evacuate team members and equipment. Keep talking, never leave them, maintain body and eye contact, prevent heat loss, and account for weather conditions.
All good points. Keeping the casualty calm and reassured is so important. Even if they're unconscious, they might be able to hear us. Using their name and maintaining a calm demeanor can really help.
And never leaving the casualty unless absolutely necessary. The bond they form with the first aider is critical. Plus, staying physically and visually connected helps keep them reassured.
Exactly. Hypothermia is a major concern too. Anyone injured is more prone to it, so preventing heat loss is critical. And always consider the weather conditions when deciding on a course of action.
This really brings it all together. We should definitely refresh our first aid training. It's essential knowledge, and being prepared could make all the difference in an emergency.
Agreed. Let's sign up for a course soon. It's not just about us. It's about everyone we go out with. Better to be safe and prepared. By the way, Sam, I was reading up on first aid procedures, especially concerning cervical spine injuries and the airway. It's pretty clear that the airway takes precedence over cervical spine injuries. What's your take on that?
Yeah, Liz, that's absolutely right. Even if a neck injury is suspected, if the victim isn't breathing, you have to open the airway. But, you need to assess the possibility of cervical spine injuries quickly before doing so.
Exactly. They mention using 2 fingers on the forehead and the chin to open the airway to minimize any force. If there's no blood or debris, this method ensures the tongue doesn't block the airway.
That's a good point. If there is blood or debris, you need to turn the casualty on their side, supporting the head and neck, and let the mouth drain. It's crucial not to twist or rotate the head.
Right, and they also suggest using the jaw thrust technique when there's suspicion of cervical spine injuries. It's an alternative that keeps the head stable and helps if the problem is the tongue blocking the airway.
I've read that too. For the jaw thrust, you place your thumbs on the chin and fingers on the corners of the jawbone, then lift the jaw up and forward. It's a bit tricky but essential for spinal precautions.
Helmets also come into play. If it's not obstructing the airway, it's best to leave it on for protection. But if resuscitation is needed, it should be carefully removed.
Absolutely. And don't forget about the casualty's dignity. It's important to maintain it while administering first aid. If you need to check an injury in an embarrassing location, have someone of the same sex present as a witness.
Yes, maintaining respect and consent is critical. If the casualty refuses treatment, continuing would be considered assault. Keeping the casualty informed about what you're doing can help with implied consent if they don't object.
Monitoring vital signs is also crucial. Keeping a record can be invaluable when the casualty reaches expert medical care. It shows whether the patient is stable, deteriorating, or improving.
For sure. The vital signs to monitor include the level of consciousness, breathing, pulse, temperature, and color. The acronym AVPU helps remember the levels of consciousness: alert, vocal, pain, and unresponsive.
Right. And even if the victim is breathing, it's important to check for normal breathing patterns. A normal rate is 12 to 15 breaths per minute. Faster rates can indicate shock.
Speaking of shock, a fast weak pulse over 100 beats per minute is a sign. For an outdoor situation, checking the neck pulse is usually more reliable than the wrist pulse.
Yes, and the temperature can be tricky to gauge outdoors. Signs like cold and sweaty skin might indicate shock, while hot and sweaty skin could suggest fever or infection. And signs like unusual warmth might indicate heat exhaustion, while coolness could suggest hypothermia.
Also, changes in skin color can be telling. For instance, pale or ash gray skin in Caucasians, dull ash gray in Africans or Asians, and pale gray in East Asians could indicate shock, while blueness of the lips, or cyanosis, signals low oxygen levels.
Moving on to treatment, if breathing is impaired, you might need to remove the helmet and loosen the PFD, but only if absolutely necessary. It's important to maintain personal protective equipment for safety.
Right, and bleeding can be hidden by waterproof clothing. Keeping casualties out of the water is crucial to help control bleeding.
If someone is less than alert on the AVPU scale, they're considered unconscious. Placing them in the safe airway position can protect their airway and prevent them from swallowing their tongue.
Shock is another major concern. It's caused by a loss of body fluids and is a serious sign. The casualty in shock should be the priority for evacuation.
Treating shock involves assessing, managing the airway, breathing, and circulation, treating injuries, reassuring the casualty, monitoring vital signs, raising their legs, preventing heat loss, and evacuating quickly.
And while first aiders should stick to their training limits, in remote locations, remote medicine with the guidance of a medical practitioner via radio or phone can be invaluable.
Pain relief is tricky too. Generally, analgesics aren't given close to medical help to avoid masking symptoms. But in remote areas, they might be necessary for shock treatment.
Yes, and giving fluids is similar. If medical help is far, encouraging small sips of water for those conscious enough can help manage shock.
Reducing dislocations, especially shoulders, might be necessary in remote areas. The key is a slow, continuous pull to relieve muscle spasms. The casualty should guide the process if they know how.
After any attempt, check the wrist pulse to ensure no major blood vessels are trapped. It's essential to monitor for color changes in the arm to prevent further complications.
Overall, the emphasis is on pain relief, preventing further injury, and ensuring evacuation is safe and timely. Following these guidelines can significantly impact the outcome for casualties in remote locations.